Picture every time I pull my hair was any outfit. You find me ugly and one day you disappear. Cause what's the point of crying? It was never enough. Did you ever want me? Was I ever good enough? Good boys are real. Good boys are real.
What is CPR?
Huh?
What is the definition of CPR? CPR stands for Cardiopulmonary Resuscitation. It is a life-saving emergency procedure performed when someone's breathing or heartbeat has stopped. It is often used during emergency such as cardiac arrest, drowning, choking, or electric shock. The purpose of CPR is to maintain blood flow and oxygen delivery to the brain and heart until advanced medical care is available. Moreover, it is to increase the chances of survival and recovery. For the cardiac arrest, it is a condition in which the heart has stopped beating. This is due to the heart muscle not getting the blood, oxygen, and nutrients it needs. Other than that, it could be due to a sudden and serious heart rhythm abnormality. When a victim is in cardiac arrest, she or he will be in unresponsive condition. The victim will not move, gasp, breathe, or cough. The carotid pulse will be absent too. In this case, we should perform CPR. There are 3 important skills to perform CPR. First, providing artificial circulation with chest compression. Second, opening and maintaining the airway. Third, providing artificial ventilation with rescue breathing.
Unresponsive adult, first we need to shake and shout. Hello, can you hear me? If there is no response, asking someone to call an emergency service and ask them to bring an AED. After that, we start chest compression. For that, we use 2 hands and place hand at the center of their chest, push down 5 to 6 centimeters and give them 30 chest compression at a rate 100 to 120 beats per minute. After giving the victim 30 chest compression, we need to give rescue breathing. First, open the airway by using head-tight chin lift and pinch the nose and seal your lips around your mouth. Repeat the cycle until medical help arrives or you are exhausted or the patient becomes responsive. If the patient is responsive, place them in recovery position.
For child CPR, the step is exactly the same as the adult, but the difference is we use one hand, the heel of the hand, and put it at the center of the chest and press it. Okay, CPR for infant. They are a little bit special compared to the adult and child CPR, as newborn baby have weaker thorax structure compared to the adult and child. So make sure not to overexert the force during chest compression. Alright, so the first thing to do in this emergency situation is observe for the infant responsiveness by blowing gently in the face or pinch a little on the body part. Alright, so first lift up the chin a little bit to open the airways. Check for the breathing. If there are no breathing detected, immediately call emergency service. While waiting for the medical expert to arrive, proceed with 5 initial breathing. This is only applicable because infant is unable to retain oxygen, so it is important to start with a rescue breath. Then start the chest compression. Use 2 fingers to pressure the chest by 3 to 4 centimeters 30 times. Along with 2 rescue breaths. Repeat this 5 times for 1 cycle. Do it until the medical team arrive. If the victim becomes responsive, place them in a recovery position.
Next, I will be explaining on what is AED. AED stands for Automated External Defibrillator. It is a portable medical device used to treat people experiencing sudden cardiac arrest. The device works by delivering an electric shock or defibrillation to the heart to restore a normal rhythm in case of life-threatening arrhythmias, such as ventricular fibrillation or pulseless ventricular tachycardia. So, let me explain how an AED works. Firstly is detection of heart rhythm. When attached to a person's chest, the AED uses electrode pads to analyze the heart's electrical activity. Secondly, shock decision. If the device detects a life-threatening arrhythmia such as ventricular fibrillation, it prompts the user to deliver a shock. If the rhythm is not dangerous, the AED will advise no shock. Thirdly is shock delivery. If a shock is needed, the AED instructs the user to press a button, delivering a controlled electric shock to the heart, which helps restore a normal rhythm. Fourth, guided instructions. Most AEDs provide voice prompts and visual instructions, making them easy to use even for people with little or no medical training. Lastly, I will show you a video that was taken during my first aid training on how an AED works.
Saya yang bawa ini saya cakap, I clear, you clear, I clear, everyone clear. Everyone kita bantu shock dulu, kita shock dulu. Okay, begini saja, teruskan saja. Semalam selesai nak. Kalau kita bangun berhenti lah. Kita bangun lagi teruskan saja. Dia dulu, boleh dia dulu. Saya tengok sini.
Remember doctor's ABC, and if you have it, D. That's D for danger, R for response, S shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've shown you the simple steps you can take to help someone who has collapsed, is not breathing, or not breathing normally.
Early initiation of CPR combined with the use of AED when needed, it can greatly increase the chances of survival. Bystander intervention before professional help arrive, it can double or triple survival rate. Community training and awareness program are essential to increase the likelihood of bystander performing CPR. To sum up, learning CPR is a vital skill that can make a profound difference in emergency. It empowers us to act quickly and effectively to save life, contributing to a safer and more prepared community.
If you're in the mood